What exactly is buccal fat removal and who is a good candidate? Buccal fat removal is a cosmetic plastic surgery procedure to remove the chubby cheeks. For people that has chipmunk cheeks or round face and they cannot lose the cheeks with diet and exercise, this is the procedure. There are multiple reasons why people could be candidates for the procedure. The number one is that you need to have chubby cheeks, but the most important one is to have high cheekbones. Can you really get a snatched jawline with just chin and neck lipo? The answer is yes, if you are a good candidate for the procedure. Hi, I'm Dr. John Mesa. I have been a plastic surgeon for more than 15 years and helped more than 10,000 of patients with different cosmetic procedures. And today, I'm going to answer your burning questions about cosmetic plastic surgery. How long do the results from buccal fat removal actually last? Buccal fat removal is a permanent procedure. Once the fat is gone, it's gone. It never comes back. But as you may know, when you undergo buccal fat removal, it doesn't mean that all the fat is going to be removed. You can remove 100%, that is the most you can remove. You can remove 50%, you can remove 70%. But even though if you leave a little bit of fat, the fat will never grow back to fill out the 100% volume that used to be there. So therefore, buccal fat removal is permanent. Is buccal fat removal reversible if you don't like the results? The answer is no. Once you remove the buccal fat pad, you cannot put the fat back exactly where it used to be. However, there are another procedures where you can camouflage the results of buccal fat removal. For example, if somebody undergoes too much buccal fat removal and they want to reverse a little bit of the results of the procedure, you can do either fillers or injectable fillers underneath the skin, or you can do a little bit of fat transfer underneath the skin. It's going to kind of hide or camouflage the results of the buccal fat removal. There are some reports where some doctors can inject the fat where it used to be before, but that doesn't really give a very natural appearance. So my recommendation is just do one of the first two ones. In conclusion, buccal fat removal is not reversible. Can you do buccal fat removal and chin lipo at the same time? The answer is yes. And that's one of my favorite combo procedures. For the buccal fat removal, you get numbing medication inside the mouth. For the chin liposuction, you get the numbing outside the area, and both can be done safely at the same time. And I love it because when you do both at the same time, you get both results almost at the same time. So you're going to look way much better than if you do them separately. Can you really do a facelift while awake? Doesn't that hurt? The answer is yes. A facelift can be done under local anesthesia, completely awake and without any pain. However, this is not the norm. The majority of these plastic surgeons or any surgeon that perform facelift surgery do not perform this procedure under local anesthesia. They usually put you to sleep with a general anesthesia or with IV sedation that is called twilight anesthesia. Very, very few surgeons like me can perform a facelift under local anesthesia. That doesn't hurt. When you do a properly made surgery with local anesthesia, you can get any kind of facelift that you can imagine. A full facelift, a middle, a lower facelift, a mini facelift, and without any pain. And yes, it doesn't hurt if it is done with the correct technique. What does it feel like being awake during facial surgery? I'm going to tell you from two standpoints, from patient standpoint and from myself. I haven't done really facial plastic surgery myself, but I have done a skin tightening and I use the same numbing procedure. I have done a lot of Morpheus on my face to maintain my skin quality. And I can tell you that when you get the numbing, you feel something is touching when you're moving, but you don't feel any pain. How long does a facelift actually last before you need a second one? The answer: a good facelift should last about 10 years. That's the average amount. No facelift is going to last longer like that. Why? Because the facelift, only what it does is reverses the age changes. What is the recovery like for a facelift without general anesthesia? The recovery of a facelift without general anesthesia actually is faster than without general anesthesia. Why? Because when you go to sleep for a facelift, you have all the side effects of the medications that are necessary to put you to sleep. So you feel very, very tired. You have a lot of nausea, vomiting. You don't feel like yourself. When you undergo a facelift under local anesthesia, because you don't have all those drugs in your system, is literally like if you went for a massage. You are done with the surgery, you stand up, you're not going to feel tired, you're not going to feel nauseous, you're not going to feel vomiting. The recovery is going to be way faster than with general anesthesia. What is facial masculinization and how is it different from regular procedures? It could be a combination of certain procedures in plastic surgery that make the face more masculine. And what is masculinity? Those kind of facial features that give you that kind of male attractiveness. Means like high cheekbones, strong chin, strong jaw angle of the face, and minimal excess of fullness in the lower face. So facial masculinization can be achieved either with no surgery, like injectables, buccal fat removal, and chin liposuction, for example, or a combination of procedures like those ones. You can do buccal with chin, with cheekbone fillers, etc. Other procedures not necessarily can make a face masculine. For example, you can do like a chemical peel. It's going to improve the quality of the skin, but it's not going to make you more masculine. There are certain areas of the face that automatically make your face look more masculine, like the cheekbones, the jaw, the chin, the lower part of the face, or any plastic surgery procedure that target those areas are the ones that are going to make your face more masculine. How do you know if you need a chin implant versus just chin lipo? It's very simple. You look at yourself in the mirror or you take a selfie, and if you notice that there is a little bit of excess of fat underneath the chin or a little bit of fullness, that's a good sign that you need a chin liposuction. To determine if you need a chin implant, try to take a selfie, which is kind of difficult, but easier if you ask somebody, a friend or relative, to take a profile picture of you in the way that shows the face like this, and this shows your profile. And then if you notice that the chin is kind of behind the lips or really behind compared with the middle portion of the face, that suggests you may need a chin implant instead of a chin liposuction. The best way to find that out is by doing a consultation with a board certified plastic surgeon that is going to be doing a full physical exam, and then is going to explain you exactly if you need a chin liposuction, chin implant, or sometimes both. Is there a non-surgical alternative to chin implants? Yes, those are called chin augmentation with fillers. And that's my favorite procedure to do to anybody that is interested in a chin augmentation. Chin implants are permanent procedures. They are surgical procedures. They cause a lot of swelling and they require a lot of downtime. And sometimes people is not really ready for that. They don't know exactly if that's exactly what they want to do. You do a chin augmentation with a filler. It's an injection. You put a little bit of medication. You put the injection, and instantaneously you can see how the chin looks like if you had a chin implant. They usually tend to last either 1 or 2 years. They can be 100% reversible. It means that if you don't like it, you can melt it away and nothing happens. When should someone consider surgery versus just filler and botox? So that depends basically into two main categories. The amount of downtime that you want, what kind of result that you want. In downtime, if you want something that is kind of fast results, like what I call Amazon Prime results, delivered kind of almost overnight or in 2 days, then the way to go is with fillers and botox injections. Why? Because those plastic surgery procedures give you almost instant result with minimal downtime. When you choose surgery, the downtime is a lot. Sometimes it could be 3 days, 5 days, but usually it's about 5 to 7 days. That's why fillers and botox the downtime is faster than surgery. But then it depends on the results. If you are somebody that wants the ultimate result, sometimes surgery is the best way because surgical plastic surgery is the gold standard. So if you want usually the best result is with surgery, and if you want something that is very close to the result that a surgery can give you, just fillers and botox would be the solution. Can injectables really replace surgical procedures? The answer is yes and no. Yes, because they can give you the result that looks ultimately as a surgical result. But why no? Because of the duration. Usually, injectables like botox and fillers give you a temporary result, while surgery usually give you a more long-lasting result. So that's why, as the question says, injectables can only replace the results the surgery can give you, but in a very short period of time, that is either 6 months, a year, or maximum usually 2 years. Will eyelid surgery make me look less tired on video calls? The answer is yes. Usually it's because they may have a little bit of excess of skin or fat either in the upper lids or in the lower lids. And with the lighting in the rooms, it creates shadows that make you look like you have heavy eyelids or like a swollen eyelids. So eyelid surgery, by rejuvenating the eyelids, basically removing the excess of skin or fat in the upper and the lower lids, gives you a very smooth contour, and therefore it makes you look not tired during a video call. What should I expect during the first week of recovery? During the first week of recovery of any plastic surgery procedure, especially on the face, the first thing that you need to expect is swelling. Swelling is the number one cause of downtime. Secondly, bruising. Every time we manipulate tissues with plastic surgery, there is veins that get cut and they can bleed a little bit and give you a little bit of bruising. and depending on the degree of bruising, it can last for a few days to up to a week. Third, pain or discomfort. Depending on what kind of tissues are manipulated and how extensive is the surgery, you may have minimal discomfort, no pain, or you can have a lot of discomfort. Usually, any procedure that involves management of the bone or the muscles are the most painful ones. But if the procedure only involves manipulation of the skin itself or the fat underneath the skin, the procedures are usually not that painful. How soon can you go back to work after chin and neck lipo? It depends on where you work. Nowadays, after the pandemic, people still work from home, or some people has to go to the office. If you undergo a chin liposuction or neck liposuction and you can work from home, technically you can start working the next day. The only difference is that because you're going to be a little bit swollen and you're going to have a compression garment, when you are going to be in a Zoom meeting or in a video call meeting, you need to turn off the camera. If you have to go to the office and you need to be in presence, I would say the downtime is 5 days. Why? Because in my case, you must wear the compression garment 5 days, 24 hours, only take it off to take it a shower. What is RF or radiofrequency skin tightening and how does it actually work? Radiofrequency skin tightening is a kind of minimally or non-invasive procedure that produces tightening of the skin. Radiofrequency is a kind of energy that when it's applied to certain tissues, it produces like a little damage that ultimately produces contraction. The radiofrequency can be delivered to the tissues in two basic ways. Kind of indirectly, like you pass in the radiofrequency through the skin, like when you have like a heating blanket that doesn't kind of does any injury, but you feel the energy. Or the other one is usually with needles, that either microneedles that go on the skin or with like a catheter that go underneath the skin and produces some little injuries in the areas that is being treated. Ultimately, what radiofrequency does is a small injury that triggers collagen formation, and once the collagen formation is being processed by the tissue, ultimately results in skin tightening. How do you maintain the results of non-surgical treatments? Very simple, with maintenance. Non-surgical treatments are procedures that do not last forever and are usually temporary, and they usually last less than a surgical procedure. Therefore, if you want to maintain the results, then you need to do it in a routine basis. This is an example that I give to the ladies and the gentlemen. It's like nails, like the fake nails or like acrylic nails. If you want to have your fancy nails always looking nice, how often do you have to do it? Patients tell me every 2 to 3 weeks. Or like gentlemen, if you want to have a nice haircut, how often do you need to do your haircut? Every 3 months. That's the same thing with non-invasive procedures. Those give you temporary result, and in order to maintain the result, you need to repeat them very often. And it depends on the type of procedure. For example, if it is a neurotoxin like a botox or Daxify, you need to do it every 3 months. If you need to do like a minimal skin tightening, you can do it every 6 months. But if you're going to do fillers, maybe you need to do it every year or any 2 years. So the key to maintain the results with non-surgical procedures is maintenance. How do you decide what procedures someone actually needs? I evaluate everything that is going on with the patient. First of all, I need to find out what is bothering the patient. Secondly, I need to find out what is going on in the physical exam. And third, then I need to outline what are the risks, benefits, and most importantly, the downtime required for the procedure. And then when we analyze that based on the specific needs for the patient, I will recommend a procedure. For example, I have a patient A and patient B. They are exactly the same physical findings. They have the same problem, but for a patient A, I may suggest something completely different to patient B. Why? Because there are different factors that make that. For example, if you are a presenter, a TV news presenter that has no downtime, usually surgical procedures that are big, like a facelift or neck lifts, are usually not recommended right away. I will go with minimal invasive or non-surgical like a botox and injections. But if you are the same patient, like patient B, but you are a stay-home mom that is not working and have all the time, and that kind of patient, I would recommend something more surgical because they have the downtime. Do you offer payment plans or financing options? Yes, of course. Not everybody has the ability to pay everything up front, especially if you are in your early stage of your career. You don't have the same economical power like somebody that has several years working or somebody that is about to retire. So because I don't limit my plastic surgery only to the patients that can pay upfront, I want to welcome any patient. I do offer financing options. If you think in this video I haven't answered any particular question that you wanted me to answer, that is not a problem. Very easy. I'll be happy to do a second version or a second step of this video with your questions. And the easy way to to let me know what questions you want me to answer in the next video is either put a comment in this video, or second, send me a direct message or a DM. With that information, I will do another video. I wanted to make this video to answer questions people have, but the issue is there are a lot of things that people never think to ask about because they simply do not know what they do not know. Which is why if you click here to watch the next video, you can check out my full guide to cosmetics plastic surgery. In that video, I go over everything that you need to know, from how to choose the right surgeon and avoid red flags, to what actually happens during the recovery that no one talks about, to the hidden cost that can surprise you if you are not prepared, and much, much more. If you have been seriously looking into cosmetic plastic surgery, you will want to check out that video. See you over there.